meniscus in your knee and in your jaw, your TMJ joint, because they're the two high impact joints in our body. You don't have a meniscus in your hips, your shoulders, your fingers, your toe. Well, if I don't have a meniscus, then how do I walk around without pain, right? Because the meniscus is what makes the space, and if you don't have a meniscus, you're bone on bone, which means you have to have your knee replaced. This is the bait and switch. The meniscus is an extra cartilage. On the end of your bone is another cartilage. This is a hard enamel-like cartilage. It's called type 2 cartilage, whereas the meniscus is type 4. There are lots of different kinds of cartilage, our nose, our ears. This cartilage on the end of your bone is the same stuff you see on the end of a chicken bone. If you cut up raw chicken, the hard white stuff on the end of the bone, that's what this is. And when you do an x-ray, the outline of your bone is actually the hard chicken bone cartilage. So when a surgeon tells you you're bone on bone and you have to have your knee replaced, he's just saying you don't have a meniscus, and he can't do arthroscopy because there's nothing there to scope, nothing to cut out. Your pain is arthritis. But what is arthritis? Is it the bone spurs, sclerosis, which means more calcium density in your bones, the lack of meniscus? No, these are all part of the disease of osteoarthritis, but osteoarthritis is an evolutionary disease over millions of years to protect and extend the life of our joint. There's only one part of osteoarthritis that causes pain, and that's called chondromalacia. Chondromalacia. Chondromalacia means little cavities in your chicken bone cartilage, little shallow pits. And as the pits get deeper, the nerves that live in your bone, right, because your bone's alive, we have bone marrow and blood vessels and nerve endings. Well, those little nerve endings, they start to feel stuff when you're walking. They're not supposed to feel anything when you're walking. You're supposed to have a nice thick layer of cartilage. They're only supposed to feel stuff if you're healthy and young, teenager running around and you get kicked in the knee playing soccer. It hurts because it's a big enough impact that the nerves underneath feel something. But walking and running shouldn't cause pain because you should have your cartilage, regardless of your meniscus, right? Because your hip's a ball and socket. There's no meniscus. It's a much thinner, narrow space than your knee, but you have the same cartilage on your hip and on your shoulder and in your fingers and even in your neck and back. The hard cartilage is protecting the bone where the nerve endings are. And when you get little cavities, little shallow pits, chondromalacia, as they get deeper, just like a toothache, you may have the cavity for years. And then one day it starts to hurt. And that's when you go to the dentist. They look in your mouth. So you have a cavity. You see it on the x-ray. Well, the dentist is going to fill your cavity and send you home if it's a simple cavity. Well, if it's a bad cavity, you might need a root canal, right? You might need a root canal, fix the pain, fix the infection, and then fill the tooth. But if it's a mechanically good tooth, we're going to try to save the tooth. Now, if it's a really bad tooth, bad infection, the tooth is broken, cracked, you're going to get a crown. I'm sure a lot of people have had crowns, but how does a crown stop your pain? Well, the crown procedure starts off by grinding down your tooth. And when they grind down your tooth, they're removing the top of your tooth where all the nerve endings are. So now your pain's gone. It's great, but you don't have a tooth, right? They just ground it away. You just got a little post. So they have to make the porcelain cap and glue that to the post so you can chew. Knee replacement's a crown. They're going to saw off the end of your bone to remove the nerve endings because that's where the pain's coming from. Because you hit the little cavity and the nerve says, ouch. Whether your joint is round and functioning or disfigured, the orthopedic surgeon, well, they don't know how to do a root canal. They don't know how to fill a cavity. They only know how to put crowns on teeth because that's their training. These are other specialties, rheumatology, interventional pain management, interventional radiology. There are ways of solving your problem that does not require amputating the ends of your bone. Imagine that. None of this is new. We've all known this.